Hello, my name is Dr. Michael Johnson, and I am an assistant professor at the UNLV School of Nursing, as well as I am a contributing founder and the chair of a national organization called Nurses Advancing LGBT Health Equality. I was asked by UMC to develop a CEU presentation for nurses and other professional staff on how to care for LGBT people. So the objectives for this presentation will be to discuss the need for providing affirmative, welcoming, and sensitive care to people who identify as LGBT, recognize the unique identities of LGBT people, describe the barriers that LGBT people encounter in healthcare settings, and then employ communication strategies that are affirmative, welcoming, and sensitive to LGBT people. So for the first part of this presentation, I wanted to define what LGBT means, as well as define some concepts that are central to understanding the different LGBT identities. And so LGBT is a commonly used acronym that I think most people are familiar with that stands for lesbian, gay, bisexual, and transgender. And although we use this acronym that sort of clumps all these people together, it really does represent a very diverse group of individuals, diverse in respect to their birth sex, diverse in respect to their gender identity, their sexual orientation, their race, ethnicity, religion, socioeconomic status, etc. So this slide will define some concepts that are important to understanding the varying LGBT identities. I'm not going to go extremely in depth with this. I'm just going to kind of scratch the surface. But this particular slide, which is called the genderbread person, this is a tool that is commonly used by people to educate others about LGBT identities and to educate people about the concepts or the terms that one needs to be familiar with to understand LGBT identities. And so the four terms or concepts on this slide, as you can see, are gender identity, gender expression, biological sex, and sexual orientation. I want to start with sexual orientation at the bottom because I think this is something that most people are quite familiar with and accepting of the fact that there are diverse sexual orientations among people. And so on one side of the continuum or the spectrum of sexual orientation is heterosexual, which is when a person is attracted to someone of the opposite sex or gender. So, you know, women attracted to men or men attracted to women. On the opposite side of that spectrum is homosexual. And so that would be your gay and lesbian individuals, which are folks who are attracted to someone of the same sex or gender. So men attracted to men, women attracted to women. Somewhere in the middle is bisexual, which is someone who is attracted to both sexes or genders. Kind of going to the top, I want to talk about gender identity and biological sex for a second, because these are terms that are important to understand transgender individuals. Transgender people, I think, is something that it's a term that I think is more confusing to certain people. Some people don't fully understand what transgender is, and so these will kind of help us understand that better. So biological sex is the sex that is assigned to you at birth, right? This is a topic that, or a concept that everyone is obviously familiar with. And so when you're born, we either assign you as female or male based on your sexual organs and, you know, your chromosomes. There are people who are born intersex. We're not going to get into that. But nonetheless, there are people who are born intersex who have both sets of chromosomes or a mix of chromosomes. And then let's talk about gender identity for a second. So gender identity is different. Gender identity is how someone feels, how they think about themselves, how they identify. And so this is where transgender comes in. So when you have a person whose gender identity does not match up with their biological sex, we broadly refer to them as transgender. And so a transgender woman, for example, is a person who is born male, has been assigned the biological sex of being male, but begins to identify as a woman. And vice versa, a transgender man is someone who is born born female or assigned female at birth, but then begins to identify as a man. Again, there are a lot of complexities to transgender identities. That's just a very broad umbrella term, but for the sake of this presentation, I'm not going to get into that. I just want people to understand kind of what does transgender mean. So now that we've kind of we've talked about some concepts around LGBT identities, and kind of and defined what those mean, I want to kind of move into the next part of my presentation, which is answering the so what. So why do we care about providing care to LGBT people, or rather, why do we care about providing sensitive and welcoming and affirmative care to LGBT people? And so the first thing I wanted to start off with was to show you some numbers, meaning how many LGBT people are there within our country and within Nevada. So as you can see, within our country, within the United States of America, there are over 10 million people who identify as LGBT. And there are over 25 million people who engage in same-sex sexual behavior, who may or may not identify themselves as LGBT, but nonetheless they are engaging in same-sex sexual behavior. In Nevada alone, the latest data that we have is from 2010 from the U.S. Census, and that showed that there were roughly 10,000 households that were led by same-sex couples. And there are approximately anywhere between 100,000 and 200,000 people who identify as LGBT. So the point of kind of putting these numbers up here is to show you that there's a lot of people out there who identify as LGBT. And so the likelihood that nurses and other professional healthcare staff at UMC, the likelihood of them encountering an LGBT person is pretty high. So continuing on answering the question of so what, so again, why do we want to provide welcoming and sensitive care to LGBT people specifically? So I wanted to just quickly go over some of the health disparities that we know exist among LGBT people. So when I say health disparities is a term that we use to denote when a certain population has worse health outcomes or more diseases or more health problems as compared to another population. There's a disparity. And so there are quite a few health disparities among LGBT people when we compare them to non-LGBT people. And these disparities are across the lifespan, starting in childhood, going into adulthood, and then going into older adulthood. Many of these disparities are mental health related, so anxiety, depression, suicide, but there's some other things like HIV and AIDS, especially among gay men and transgender women. There are more cancer risk factors and less cancer screenings among lesbian women as compared to heterosexual women. There is a higher risk for cardiovascular disease and a higher prevalence of obesity among lesbian women as compared to non-lesbian women. And so this is just to show you that we should be concerned about LGBT people and their health, because their health is unfortunately worse off as compared to non-LGBT people. So after people learn about the numerous negative health disparities that affect LGBT people as compared to non-LGBT people, the next logical question typically is why is that so? What are the reasons behind these health disparities among LGBT people. And really what it comes down to is stigma. Stigma, by definition, it's a mark of disgrace associated with a particular quality or of a person. And so stigma are typically negative and usually unfair beliefs about people. And so LGBT people in American history and still today are stigmatized, right? They're seen as different than non-LGBT people. And so that results in things like homophobia, discrimination, bullying, physical violence. They're rejected by their family and friends. There are actual legal sanctions, laws against LGBT people, and all these things that LGBT people have to experience in life, experiencing the discrimination and then the rejection and the possible physical violence, all of these things have serious consequences. They have consequences especially to mental health, and so that's why we see a lot more depression and anxiety and suicide in people. People have, low self-esteem, usually low self-worth. These are some of the consequences that happen when a person is stigmatized throughout the course of their life. And so all of these things can in turn affect their physical health, which is why we see a lot of physical health disparities among LGBT people. And so people they may stop doing self-care behaviors. They may stop going to their healthcare providers. They may start using drugs and alcohol and smoking to cope with the effects of stigma, the depression, the anxiety, the low self-worth, things like that. They might start engaging in risky behaviors in terms of having unprotected sex, which leads to an increased risk for HIV as well as sexually transmitted infections. And so that's really why we see all these health disparities among LGBT people. It's really rooted all in stigma or homophobia or discrimination, whatever word you want to use. Stigma also has had a serious effect on the access and utilization of healthcare services among LGBT people. The research evidence is pretty strong in showing that LGBT people use healthcare services much less often as compared to non-LGBT people. And those healthcare services are across the board. In regards to, they use just less primary care services, meaning they visit their primary care provider less often as compared to non-LGBT. LGBT people underutilize cancer screenings. Lesbian women especially underutilize cervical cancer screening and breast cancer screening as compared to non-lesbian women. Transgender individuals especially use less healthcare services in regards to, again, primary care, preventative care, as well as acute care services, meaning they will forego going to the ER, going to the hospital less often as compared to non-LGBT people. And many of the reasons for this, again, are very much rooted in stigma and discrimination. And so I wanted to talk about what are the barriers that LGBT people encounter when trying to access or using healthcare services. And that's where the remainder of this presentation is going to go, is focusing on what nurses can do to kind of help alleviate that a little bit. And so there are three major sort of barriers that I want to talk about. The first is perceived or actual stigma. The second is structural stigma. And the third is provider knowledge and training. So in regards to perceived and actual stigma, let's talk about that first. So just think about the life of an LGBT person for a second. As I mentioned before in the last slide, many LGBT people, not everyone, but a large majority of them, go through life experiencing different forms of stigma throughout their life, whether it be immediate stigma from their family, meaning that they've been rejected by their family, kicked out of their homes as teenagers, or disowned by their family as teenagers or young adults, whether that's being bullied in school because they're gay or lesbian or transgender, whether that's, they have experienced physical violence. Many transgender individuals have experienced physical violence throughout their life. They may have been fired from a job, or they may have been denied housing. All of these things throughout their life have an effect on people, and it creates a fear in them. Obviously, no one wants to experience those types of events in life. No one wants to be discriminated against, or experience physical violence, or what have you. And so it creates a fear in many LGBT people of when is the next event going to happen? When am I going to be discriminated against next? And they're many people are on constant high alert because of that. Well, this very much translates into healthcare. Even if an LGBT person has not experienced a negative sort of encounter in a healthcare setting, meaning that even if they've never have had a nurse or a doctor or a receptionist say anything negatively toward them, even if they've had all positive encounters, just the fact that they may have experienced discrimination throughout their life may put this fear into them that they don't want to put themselves in a vulnerable position of going to see a healthcare provider where you have to disclose your sexual orientation, or you may have to disclose your sexual orientation, or disclose that you're transgender, and you're not quite sure how the nurse is going to react to you, or how the doctor is going to react to you, or how the receptionist is going to react to you. And so that's when we say perceived stigma, that's what that means. But there's also actual stigma that occurs in healthcare settings. There are many cases throughout the United States that happen today, where a person who identifies as LGBT goes into a hospital or a healthcare clinic, and they unfortunately are on the receiving end of perhaps a gay slur or a transgender slur. The nurses or the doctors they encounter may be homophobic and may treat them differently. They may be snickered at, especially transgender people are commonly, kind of made into almost like a freak show sometimes in a hospital settings where, once someone finds out that there's a transgender person on the nursing floor, that people will come and will kind of snicker at them and look at them and things like that. Like these encounters happen every day in the United States. There are patients who have actually gone into providers' offices or into hospitals and have been denied care, or have had nurses say I'm not taking care of that patient today because they're gay or they're lesbian, they're transgender. And so when these types of events especially happen, of course, it's going to create a fear in someone, and they are less likely to return to the hospital or to a healthcare setting in the future. Structural stigma is a term that we use that for in the case of this presentation, anyways. When I say structural stigma, we mean hospitals and healthcare systems that are not set up to welcome LGBT people. And so imagine being a gay man walking into a hospital and filling out the forms, and the form never asks you your sexual orientation. The form never asks whether or not you're married or partnered to someone of the same sex, or a transgender person. Let's say a transgender person walks into a healthcare facility. There's nowhere on a healthcare intake form that they can disclose that they're transgender, right? That their gender identity is different than their biological sex on their birth certificate. You walk into a healthcare facility and you look at all the posters on the walls and all of the brochures that are out on the tables, and they all depict heterosexual people, or people who look to be heterosexual, or there's no one on these forums that look to be that show the LGBT person that it's welcoming to LGBT people. All of these types of things are stigmatizing to some LGBT people, and it creates fear in them that maybe this healthcare facility that I'm in is not welcoming to me. And then the last thing is provider knowledge and training. The fact is that there are many healthcare professionals, whether it's a nurse, whether it's a physician, whether it's the receptionist who's doing the intake of the patient, who just does not have a good knowledge base about LGBT identities, or have not received the training on how to care for LGBT people. And so oftentimes LGBT people in healthcare facilities, they are unfortunately on the receiving end of nurses and physicians and whatnot who are using language, or who are using words, who are asking questions that are insensitive to the LGBT person. And oftentimes this is very unintentional, right? The nurse or the physician or the receptionist, they're not in most of the time they're not using words that are going to intentionally harm an LGBT person, or intentionally be hurtful to someone, but it's just that they don't have the knowledge or training to know the right words to use or the right questions to ask. So I'm including this slide just to kind of reinforce what I was talking about on the last slide. So this is a model that came out of one of the research studies that I conducted a number of years ago, 3 or 4 years ago, on healthcare experiences among lesbian and bisexual women. And what this study essentially showed was that LGBT people, when they go to their healthcare provider, and when I say healthcare provider, that may be going to a physician's office, going to their primary care office, or it may be in the hospital when they are working with a nurse, that when they disclose their sexual orientation to their provider or their nurse, they expect a few things. They expect that their healthcare professional is somewhat knowledgeable about their LGBT identity, that they know how to communicate with them using language that is sensitive and appropriate, as well as that they have a positive and welcoming attitude toward them, and an accepting attitude toward them, and that if these things don't happen, so if a LGBT person does go to a hospital or a provider's office, and they experience a negative encounter with a nurse or a physician, meaning that they didn't communicate so well, or they had a really unaccepting or really negative attitude, that this actually can have an effect on subsequent healthcare behaviors of the LGBT person, that they may actually change the way that they go and seek healthcare in the future. They may actually withgo healthcare. They may decide that, actually, I don't want to have another negative encounter ever again, so I'm just not going to go to the hospital altogether. I'm not going to go to the doctor's office altogether. Or they may disguise their sexual orientation in the future. They may feel so unsafe that they just say, I'm not going to tell any of the nurses or the doctors that I'm gay, or I'm lesbian, or I'm transgender. I'm just going to hide it. And so these are just some of the things that can happen. And we don't want we obviously don't want our patients to withhold important information from us, from us as nurses or their providers, their doctors. We want to know if a patient, we want to be able to provide holistic care to a patient, and so we need to know, what their family support system looks like, and what type of sexual behaviors they're engaging in, and especially, if they're transgender, we need to know that they are taking hormones, or that they're in the process of transitioning from their biological sex to to their gender identity. And so we as nurses and providers, it should be important to us to know how to provide sensitive care and affirmative care to LGBT people so these things don't happen. So the next set of slides, actually the remainder of this presentation, is really going to focus on some tangible things that you can do as a nurse or a healthcare professional to ensure that you are providing sensitive care to LGBT people. And so I wanted to start off with just kind of bring us back to our roots. You know, what's the goal of the clinician provider and patient relationship? Right? It's to be therapeutic with them. It's to be compassionate. It's to develop a trusting relationship. It's to be respectful. It's to have a genuine relationship. You want to be genuine as a nurse, and you want the relationship to feel safe from both the healthcare professional standpoint, but also you want the patient to feel safe when they are working with you. And so we want to be able to accomplish that with all patients, right? Regardless of race, ethnicity, sexual orientation, gender identity, socioeconomic status, different backgrounds, culture, it doesn't matter. We want to be able to do this with each individual patient. So these are three very broad approaches that healthcare professionals can use when working with any patient. But these things especially will make the LGBT patient feel a little bit more welcomed and a little bit more accepted and safe when in a healthcare environment. First off is being non-judgmental, right? So each one of us, each person has biases based on our own life experiences, based on our culture, based on our life perspective, based on our religion, based on our politics, whatever it may be. Each person, each healthcare professional has a set of biases, and it should be within us though to not impart those biases on our patients, to make sure that those biases that we may have towards someone is not reflected in the care that we give to a patient. So being non-judgmental. Not making assumptions is hugely important when working with LGBT patients. So when you are working with a person who may look feminine, for example, so you're working with a man who looks feminine to you, right? You don't want to automatically assume that this man is either gay or that this man may be transgender, or vice versa. You know, if you're working with a woman who may present as more masculine according to sort of our American standards, we don't want to make assumptions that they are a lesbian or that they are transgender. And so not making assumptions. Not asking unnecessary questions. This is especially this is an issue that is unfortunately quite prevalent. That many LGBT people report that when their healthcare providers or their nurses discover that they are in fact gay or lesbian, or that they are transgender, that oftentimes they are on the receiving end then of inappropriate questions from the nurse or the doctor. So just remember that as healthcare providers, we need to ask a lot of questions, right, to be able to provide care to our patients, and we have to ask a lot of very personal or probing questions at times. But just make sure that those questions are necessary to the care that you are providing to your patient, and that the questions you're asking are not just to inform a curiosity that you may have. This is especially true for transgender individuals. Many transgender people report that their providers ask unnecessary questions that are not at all relevant to their care. So these are kind of just three guiding principles, I guess you could call them, that I think are really important when working with any patient. So in American society, we are very much what we call a heteronormative society, meaning that we automatically use language that assumes someone is heterosexual. So when you encounter someone, for example, right, when you meet someone, whether it be a patient or you meet them at the store, and you discover they're married, if their partner is not with them, if their spouse is not with them, most of us automatically assume, oh, they're married to someone of the opposite sex, right? If it's a man, oh, they must be married to a woman, or if it's a woman, oh, they must be married to a man. And so that's very common within society that we have these very sort of heteronormative assumptions about people. And unfortunately, those types of assumptions can create a very unwelcoming environment for gay and lesbian or bisexual people and transgender individuals as well. This slide is more toward sexual orientation, but definitely does apply to transgender individuals as well. So we want to be able to use language that is inclusive to all people, to all sexual orientations. And so we should try making it a habit to try to avoid using language or words or asking questions that automatically assume that someone is heterosexual. The reason we want to do this is if you are working with a gay client, for example, a man comes into the ER, for example, and you need to contact one of his family members for whatever reason. You want to get in contact with his spouse to tell his spouse what's going on with him. And the question out of your mouth is, the first question is, oh, are you married? And he'll say, oh, yes, I am. And then the next logical question that most people will ask is, well, what's your wife's name? In many people, in many LGBT people, this automatically signals to the patient that this may not be a safe environment because they're asking who my wife is. They may think to themselves, is it okay for me to disclose to the nurse right now that I don't have a wife, that I actually have a husband? And they may or may not disclose to you that they have a husband. And we don't ever want to put a patient in that predicament to make them feel unsafe or that they're not welcomed. And so there are very small things that we can do in the language that we use, the words that we use, and the questions that we ask. Very small changes we can do that are inclusive to everyone. So we want to avoid words such as husband, wife, and mother and father. We want to use or ask questions such as, do you have a partner or a significant other? What is the name of your spouse? So, or who is your support system? Ask these very broad, open-ended questions that we're not assigning gender to, right? So we're not saying, who is your wife or what is your wife's name? It's well, what is the name of your partner or what is the name of your significant other? And that can signal to the patient that, oh, this nurse is accepting of me. Because it's a very inclusive kind of question. When we're working with kids especially, but it may be an adult patient as well, and we want to know about their parents, right? We want to ask them about their guardians. We want to avoid words such as mother and father, because the reality is that we live in a time where many kids may have two mothers or may have two fathers, or LGBT aside, they may be raised by a grandparent or an aunt or an uncle, or they may be in a foster care system. And so it's good to get in the habit of taken those words out of your vocabulary when working with kids, especially, and just asking very gently, what are the names of your parents, or who are your parents, or who are your guardians, or who are you living with, or who's taking care of you, something like that, so you don't unintentionally make someone feel unwelcomed or unsafe. One easy communication approach that we can use to help LGBT patients feel more welcome, make them feel safe when they are in a healthcare setting, is to simply reflect their language, reflect the patient's language. Meaning, using the terms that the patient uses to describe themselves and to describe their partners, to describe their family units, just mimic or mirror their language. And so, for example, if you are working with a patient who is a gay man and his husband is sitting next to him and he says, to you as the nurse or the healthcare provider, this is my husband Antonio, that's the word that you want to use if you have to refer to your patient's husband Antonio. You don't want to suddenly start using a different word like, oh, this is, the patient's partner Antonio, or this is the patient's friend Antonio. No, that is the patient's husband Antonio. But if the patient says, this is my partner Carmela, then use the word partner. Or if a patient says, this is my wife Luis, then use the word wife. The same thing goes for identity. If a patient discloses to you that they are a gay man, so if a patient says, I am a gay man, don't suddenly start using the word homosexual instead, right? So if you are giving a report to a nurse on your patient Fred, and your patient Fred has said to you, oh, hi, my name is Fred, I am a gay man, and this is my husband Antonio. When you're giving a report to the nurse or to the provider or whoever, and you're in earshot of the patient can hear you, and you suddenly say, oh, Fred is a homosexual man and his friend Antonio is in there. That suddenly sends the message to the patient that this is not a safe environment anymore. The patient may feel as though the healthcare staff, the nurses and the providers, are not accepting of LGBT people, and that he is not welcome there anymore. And we've already talked about the effect that can have on someone in their future healthcare decisions. And so it's best to use the language or the terms that your patient uses. So I want to transition into talking about some communication strategies when working with transgender individuals. I wanted to just go over a few definitions again, just to remind everyone of what these different identities refer to. When we are talking about trans men or transgender men, these are people who are born female. So at birth, they are assigned to be female. Their sex is assigned as female, but they have transitioned into being a male. They identify as being a male. A trans woman is someone who at birth is assigned the male sex, but identifies as a female or identifies as a woman. Gender queer is a very commonly used term in the transgender community. A gender queer refers to someone who does not conform to a specific gender at all. So they don't identify as male, they don't identify as female, they identify with something in between, or they may identify with both, or their identity may fluctuate from day to day. So those are just some quick terms, just as a kind of refresher. So when we're working with transgender clients, we first want to ask them what their preferred name is. And we should actually be asking this of any client or any patient that we work with. We should be asking patients, what would you prefer I call you? What name would you prefer I use, right? Because LGBT aside, there are some patients who want to be referred by Mr. or Mrs., right? I want to be called Mr. Johnson, or I want to be called Dr. Johnson. And so we should be asking that generally anyways. but especially with transgender clients, because oftentimes their preferred name does not match with their legal name, and so you want to use a name that they identify with and that they're comfortable using. You want to be asking about preferred pronouns. So if you are ever in the instance where you are working with a transgender patient, we want to ask them, what pronouns do you want me to use when talking to you? And so when we say pronouns, right, those are things like him, her, she, his, right? So if we are working with a client that we assume to be male, it's just natural for us to use male pronouns, right? Him and he. But the patient may not want that. The patient may want you to use female pronouns because they're transitioning to become a female because they identify with being a woman. And so it's good to ask transgender patients what the preferred pronoun is. And also refrain from titles, Mr., Mrs., Ms., etc. So when I'm working with patients, regardless if I know they're LGBT or not, when I look at their first and last name, right? Let's just use my name, for example, Michael Johnson. If I'm walking into a room with Michael Johnson, I'm not automatically going to assume that it's Mr. Johnson. So I'm not going to go in and say, hello, Mr. Johnson. I will say, hello, Michael. Introduce myself, and then when it's an appropriate place in the interview, I'll then say, Michael, is that the name you would prefer me to use, or would you prefer me to use a different name for you? And that would give the patient the opportunity to say, oh no, my name, it's not Michael, it's Michelle. So again, refrain from titles, not walking into a room and saying Mr. Jones or Mr. Johnson or whatever. So one of the common questions that I get from nurses and healthcare providers and whatnot is how to ask about identity. So unfortunately, many hospitals and healthcare facilities do not yet ask patients about their sexual orientation and their gender identity on the intake forms. We should be. In fact, there are many hospitals around the country that are finally adopting these questions. So when a patient comes in, the form will actually ask them to identify their sexual orientation, which signals to the patient that this is a safe place, that I can disclose to the staff here that I am a gay man or a lesbian woman or a transgender person. But unfortunately, a lot of hospitals are not on board with that yet, and so it really is left up to the nurses and the physicians and the other healthcare providers to be asking these questions. So one way to do that, so before we talk about the questions, hopefully, if you asked questions, broad questions that we mentioned earlier on about asking the patient about whether they had a significant other or a partner, hopefully those questions signal to the patient that it's a safe space to disclose your sexual orientation, and hopefully at that point in time they had already disclosed to you that that they're gay or they're lesbian, or that they have a same-sex partner. But if not, then this is the time that you could ask about their sexual orientation. And so the easiest way to do it is just to matter-of-factly say, or matter-of-factly ask, how would you describe your sexual orientation? And if a patient's really confused by that, you could say, well, do you identify as straight or heterosexual? Do you identify as gay, as lesbian? And most patients should not have a problem answering that question. If they do, you could use the excuse that, well, it's not an excuse, but you could use the reason that the Joint Commission recommends that nurses ask patients about their sexual orientation, because the Joint Commission actually does. The Joint Commission released some guidelines a few years ago that actually strongly recommends that nurses and physicians and hospitals, that they that they ask patients to disclose their sexual orientation, because we know through years of research that patients, LGBT patients, they want to be able to disclose their gender identity and their sexual orientation. They want to be able to disclose those things to their healthcare provider. If you're working with a transgender client, you could ask very broad questions of, how would you describe your gender identity? And what was your sex assigned at birth? Those are the two common questions that are asked when working with transgender clients. So there are not everyone in healthcare environments need to ask patients about sexual history, but there are specific areas and at certain times where nurses and providers need to do sexual risk assessments with patients. And that's definitely a time and an opportunity where you can ask questions about sexual orientation. And so these are some screening questions that are recommended actually by the CDC. And so starting off with saying, I'm going to ask you questions about your sexual history. I ask these questions at least once a year for all of my patients because they are important to your health. So starting off with, have you been sexually active in the past year? If they say, yes, I have, then you can say, do you have sex with men, women, or both? And that is a great way to just assess the sexual behaviors of your patient. So when I do these types of trainings, one of the common concerns that nurses have is, well, what if I, what if I am working with an LGBT client and I say something that is insensitive to the patient, even though I didn't mean it? It was not intentional, but I used the wrong word, or I realized that I offended them with a question I asked or a term I used. What do I do now? So the reality is this, is LGBT people are very much used to kind of moving through life in a society that is not fully accepting of LGBT people. And so they've had to, most have had to figure out how to maneuver that and expect that along the way people are going to say things and do things that are offensive but unintentional. And so if you are working with a patient, don't be surprised that an honest mistake on your part may result in an emotional reaction. Because as I said, patients may have experienced insensitivity or discrimination in the past. And so they might already kind of be on guard, especially when working with nurses and physicians, because it's a very vulnerable situation that they're in. And so they may be on guard or very defensive already. But as nurses or providers, if you do make a mistake, just apologize for your mistakes. Or if you notice a coworker had made a mistake, correct them. Just doing these things can really help diffuse a difficult situation and can really just help reestablish sort of a very constructive dialogue about the need for care. And so just just being very matter of fact and saying, I'm so sorry I'm so sorry I said that, or I'm so sorry I used that word. I did not intend to mean any harm. Please help me. Please educate me, or please help me understand what words I can use that are not insensitive or discriminatory towards you. And most patients will understand that and will educate you and be fine with it and move on. So I wanted to talk about the healthcare environment just for a moment here. especially to those nurses or providers who are watching this presentation that actually have some say over the healthcare environment. You know, they have some, they are in a decision-making role where they have some, you know, they have some responsibility or clout over the environment that you're in. We should be asking about sexual orientation and gender identity on intake forms. It should be done. And again, most hospitals, unfortunately, especially in the Las Vegas Valley, are not asking these questions, and we should be. And so if you have any decision making over that, I would really strongly encourage you to advocate to include those questions. Making sure that all forms have gender neutral and inclusive language, especially, you know, taking away Mr. and Mrs., those types of words, and removing words like mother and father, and instead using the words parent or guardian. Prominently posting any kind of non-discrimination policy around the hospital that you know, that communicates to LGBT patients that we that you are accepted here and that we will not discriminate against you. Of course, LGBT inclusive brochures. LGBT welcoming signs. There are some hospitals in the Las Vegas Valley, and I'm not sure if UMC is one of them or not, but there are some hospitals in the Valley that actually have Human Rights Campaign stickers posted around the hospital. Human Rights Campaign is a very prominent national LGBT advocate policy organization, and they have an equality symbol sticker. And there's a few hospitals in town that actually post these. And so posting those things, again, signals to the patient that, hey, we are accepting of you. For any nurses in leadership capacity roles or healthcare providers who are any kind of leadership roles who are watching this presentation, these are, again, some things that you can do that can really help from a system standpoint signal or communicate to the patient that we are welcoming to you. So again, adopting a non-discrimination policy, adopting a policy about equal visitation rights, adopting a policy that identifies the patient's right to identify a support person of their choice, making sure that there are nurses and staff and provider champions around the hospital who have expertise with LGBT issues, and then identifying someone to oversee sort of organizational efforts to make sure that the hospital as a whole is providing culturally competent care to LGBT patients and their families. So that is the presentation. As you can see from the last few slides, it's really not very difficult to incorporate some of these very small changes in your daily practice with words that you use and questions that you ask that will ensure LGBT patients feel welcome, they feel safe, secure, they feel accepted when they are in your healthcare facility, when they're visiting UMC. And so I really do hope that everyone begins to adopt these very small changes because they will go a long way. If you have any questions at all, or if you want to talk further about this, or if you want to talk about how we can implement some changes on a larger level, please do not hesitate to contact me. There is my email address. It's michael.johnson@unlv.edu, and my office phone number is 702-895-5934. Thank you so much for your time.